Dear colleagues, we go on with our working day, and the topic of the next briefing is starting charity events Save and Drop. The blood drive for the wounded ATO soldiers and those injured in the fire on oil storage in Kyiv region. The first to speak is going to be Svyatoslav Janko, co-founder of the charity Volunterska dopomoga, volunteer help. Good afternoon, I am Svyatoslav and I am one of the organizers of the charity foundation International Volunteer Help. We are announcing today we are announcing an event called Save and Drop. I guess everybody knows and remembers that we have a war, not the anti-terrorist operation as they say, plus next to Vasylkiv in Kyiv region, oil storages have blown, and we have for long sought to help the anti-terrorist operation forces and the burn center, medical center in Kyiv, where our fighters are being treated, where the collection of blood is concerned. I want to thank in advance everyone who helps us with this event, those who will come on Monday, Tuesday and Wednesday to give their blood in higher educational establishments. I'll talk about this a bit later. And today, the head of the department of our burn center of the Kyiv Clinical Hospital number 2, Oleg Shchyryi, had to be here, but because he's got a lot of work after the fire next to Vasylkiv, there will be other people who will tell us about where and when this event will happen. I also want to say that probably not everyone knows, and maybe many people don't know, blood is being stored for only 42 days. In Europe, this term is 36 days, but our doctors, out of their experience, say that after 30 days, the blood is already falling apart to ingredients, and they don't use it after 30 days. However, plasma is stored for several years, but all the other ingredients have a very short term of storage. As far as donors are concerned, I want to address those who will give their blood, that they should have their passport and identification code. You cannot fill in the forms without it and give blood. Also, the age should be from 18 to 52, the doctors say, not more. Weight, although surprising, it does influence the donor. If it is less than 54 kilos, you're not allowed to give blood. Not only students can be involved in our event, but also those who can do this. They can come to give their blood and together with everyone give their blood. The event starts on the 15th of June from 9 to noon on the territory of Kyiv-Mohyla Academy, 5/7 Volunterska Street. On the 16th of June, it's going to be in the Kyiv National Economic University on Peremoga Avenue. And then on Wednesday, Kyiv Clinical Hospital number 2 on Popudrenka, or people call it the burn center. As far as giving blood is concerned, I can tell you that we almost don't have culture of doing this. In Europe, for 1,000 For 100 people, 12 to 15 people give blood in Ukraine. In Europe, the figure is 25 to 30. In America, 42 to 50. So the culture of giving blood is almost absent in our country, and people somehow think that this is not necessary, that someone else can do this. But I ask you, if you have such an opportunity, if your health allows this, please join in this event. We will hold such events depending on the needs and the requests of the military hospital or burn center or other medical facilities and centers that need blood. I also want to thank those companies and people who responded to our action. I hold a bracelet, a silicone bracelet, which says, "I am a saving drop," and to those who will be ready to give their blood, give blood, save a fighter. This is the Kyiv company Volunterska, who manufactured 400 such bracelets for free for us, and we will give them out to students as a reminder that someone was concerned and saved somebody's life. Also, we were helped by R&P firm as far as printing matter is concerned. The mega market at the Bolshevik Trade Center helped us because we had to buy express tests to test blood, and Soldy.co company called us an hour ago. They agreed to pay for 200 such tests, and we are very grateful to all those who have joined in our event and will join us. I also want to thank everyone, including representatives of universities who started to work with us, not only young people, but senior people as well. We want to invite to take part in our event representatives of big corporations who can help us with money to buy the necessary express tests and food. And now representatives of universities will speak.
Good afternoon, of the School of Healthcare of Kyiv-Mohyla Academy. We see realization of our mission not only in scientific, in academic and educational work, but our mission can be realized in education and volunteer activities. Since 2011, in the School of Healthcare in the Kyiv-Mohyla Academy, we initiated an activity of providing donors' blood and collecting donors' blood, and it was initiated by our student who graduated from Mohyla Academy, and she was a master degree, and she worked in city center, Kyiv city center of blood, and she was so involved, and she decided to hold a campaign of Donors' Day in Kyiv-Mohyla Academy, and in 4 years a lot of was done, and we have a club of donors of blood. We have a database. We developed information materials, and I can show them to you. And with all the information, about responsible donorship, and we hold a Donors' Day twice a year, usually in spring and fall. In average, we receive about more than 100 people, and intake of blood holds place. We take blood from 75, because all absolutely healthy people can be donors. And our last activity was on April 15. and we could collect 31 liter of blood. Of course, we are proud that the initiative of our students was able to save lives of many patients in Akhmaded and in Kyiv Center, National Institute of Cancer, and of course on the eve of the day of Donors Day, I would like to bow to all who participate in donors activities, and people who are able and ready to change this world, to help the life of people. No microphone, and I invite, and I would like to remind you to take your passport and come to care, and don't drink alcohol for 48 hours. Good afternoon, dear friends, dear conscious citizens of Ukraine. I am Olga Chabanyuk, and the head of the Organization of Students and Graduate Students of Kyiv University after Vadim Hetman. Yes, donorship in Ukraine is a big mission, great mission, and that requires from everyone a lot of responsibility, because not everyone can become a donor, and first of all, that should be an absolutely healthy person. And donorship in Ukraine, there are a lot of discussions around that. Some people are afraid to be donors, some people don't want to, but there is one more category of people who are happy to become donors in Ukraine now. The administration of Kyiv National Economic University and Director Anatoly Pavlenko and Organization of Students and Graduate Students and all active students where they agreed to educate and to educate the culture of donorship. What's that? Not a lot of attention was paid to that in Ukraine, but because of the events that we are holding in the east of Ukraine, we have in the east, and events in the country, everybody understands responsibility, especially women who don't have a chance to go and somehow to help in the east, and men who, because of some activities, cannot participate in ITO, and they can express they can do something like civic activists, they can become donors, and they can help people who stand for borders of our country, who stand for our honor. And that's why Kyiv National University and Economic University and Economics University, we were extremely happy when an international charity fund volunteers aid, when they spoke to us and to hold an action, a drop of for saving, and so give your blood, save our soldiers. We now understand how we can help our soldiers in the east. They brought to hospitals in different cities of Ukraine, and doctors are fighting for their life, and with our blood we can help people's life. We can help them to survive and their families, because every person is linked to children, women, parents who care every day, who worry every day, and they're waiting for their man to come healthy. That's why on June 17, 2015, is from 9 to 12 p.m. we will hold, we will receive people from in Kyiv National Economics University. There will be representatives from the military hospital. They will take blood, and we are confident that if those people who do that, they will help Ukraine. They will help our soldiers. Coming out of the experience we had, we can say We can inform about donor, all the donor campaigns were supported in our university and state medical center of children's cardiology and surgery on brain. They spoke to us because they needed blood for kids and to make insufflation of heart and on heart. We should develop the culture of donorship in Ukraine because abroad it's quite spread and maybe our people don't know about advantages or benefits to donors in other countries. So they could get they can get free treatment of their teeth, their limbs in state hospitals. They can get dental prosthesis and limb prosthesis in their hospitals. So they can get additional 20% to the pension. They can get a lot of benefits. So we need to discuss them and to encourage people to become donors. And one of the most important points, we very often don't care about our health. And every year we cannot be diagnosed, but when we become donors, we could take free of charge to diagnose and they can find something, and people go to give their blood and they think they are healthy, but because of a diagnosis we could identify some problems in their health and they can so go for a free treatment. That's why we should popularize the donorship in Ukraine. We should work on that, and everyone who becomes a donor should get a lot of personal, individual benefits.
Thank you for this exhaustive briefing. If there are any questions, several questions to Svyatoslav. Is there a number of liters of blood that military and those who have suffered as a result of fire need? And do you plan to collect any amount? And what is the most needed blood group? Well, as usual, everything that is that pertains to specific questions is classified now, and I am sure that the information about those who died as a result of fire and the rest, at the moment no one told us how much blood they need. However, when we were preparing the action event, they said, we won't be able to take more than 50 liters from you. And also I want to tell you about blood, that there's one center in Sumy which has a license and is allowed to take blood themselves. All the other are enterprises of communal ownership do not have the right to directly take blood. The situation is that between state and communal enterprises, the biggest center is Bila Tserkva. They exchange blood for money, and 1 liter of blood costs 2,000 hryvnia. You cannot transfer or give as a present blood. And the head of Center of Blood in Bila Tserkva, Petro Verbitsky, was speaking at press conferences. Until now, the Ministry of Health has not conducted tenders to buy tests for examining people's blood before blood is taken. And when we were studying the situation with blood, we came to the conclusion that you should do a pinpointed blood collection. For instance, if this is needed for a military hospital, then they will take it, and the military hospital will retain, or the burn center, or the regional center for blood transfusion in Bila Tserkva. They cannot even transfer it to anyone. There is a resolution of the Cabinet of Ministers that if you want to transfer blood to the anti-terrorist operation zone, then you can do it. But as we know, since the anti-terrorist operation started, there was not a single case when the Kyiv region, for instance, gave transferred blood to the anti-terrorist operation zone. Only in Kyiv, in our clinical hospital, there's a blood transfusion service, but not in Odessa, not in Kharkiv, not in other hospitals. They just get blood from someone and they are not allowed to collect blood themselves. Within 24 years, we have ruined donor movement not only in the army but in the country. So you collect blood, after which it goes to laboratory and then to fighters. No, we do not collect blood. Blood is being collected by, for instance, the burn center, and they take it for themselves. They cannot pass it on to anyone else. And the clinical hospital, for instance, goes to universities and they collect blood there and they retain blood in their hospital. Otherwise, you cannot do this. This may be done only by the clinical hospital or by the burn center. For instance, if you need to do this in Dnipropetrovsk, then we have to carry people to Dnipropetrovsk. And what is the most needed blood group? The specialists say that they need every type of blood, because it's been reworked into ingredients and it's been distributed to every clinic. There's no such case when, for instance, you need group 4 with rhesus factor minus. There are complicated situations when they say we need donors of this and this group today. And so, together with universities and other organizations, we want to initiate the bank of blood in Ukraine. There is no such thing in Ukraine. I don't know why. So we suggest that there's a round table of specialists which will discuss why don't we have the bank of blood, or why don't we want to do it, because this is very useful. If you need some blood group, then you just call and you get it. For instance, I think that what's now happening in Vasilkiv is as usual. There's a fire, and the law says that the state has to create this blood bank. So far we don't have it. Any other questions, colleagues? A technical question. Is there an information on this topic, on this event in social networks? As of today, it will be spread, disseminated on sites of the Academy and in social networks. As we have the club of blood donors, we ask them for help. And yesterday they have disseminated this information on the Facebook and also put it on the site of Kyiv-Mohyla Academy. As we do this since 2012, the Blood Donor Club sent the messages out. Thank you very much for this very useful cause and event. Thank you very much. We